Hello, good morning. Today we'll clear the concept of spleen. Spleen is secondary lymphoid organ and plays important role in the immune system. Spleen is present in all vertebrates and it primarily acts as a blood filter. That is, if any antigen is present in the blood, that is filtered through spleen. So it plays very important role in regard to RBC and the immune system. It removes all old red blood cells and holds a reserve of blood which can be valuable in case of hemorrhagic shock and also recycle iron. As a part of mononuclear phagocyte system, it metabolizes hemoglobin and removes the senescent red blood cells. The globin portion of hemoglobin is degraded to its constitutive amino acid and the heme portion is metabolized to bilirubin, which is removed in the liver. The spleen synthesizes antibodies in its white pulp and removes antibody-coated bacteria and antibody-coated blood cells by way of blood and lymph node circulation. In humans, the spleen is purple in color and is in the left upper quadrant of the abdomen. The spleen is a center of activity of the mononuclear phagocyte system. The spleen, it consists of red pulp and white pulp. The mechanical filtration of RBC is done in the red pulp. It is a reserve of monocytes. It is composed of sinuses which are filled with blood and the marginal zone bordering the white pulp. Whereas the white pulp, active immune response through the humoral and cell-mediated pathway takes place in the white pulp. It is composed of nodules which are composed of lymphoid follicles which are rich in B lymphocytes and periarteriolar lymphoid sheath, that is PALS, P-A-L-S, rich in T lymphocytes. So spleen, it consists of the following parts: capsule, the outermost covering. Then the capsule, it will descend down in the form of a trabeculae, hilus, from where the artery and vein they come and leave. Then white pulp scattered throughout the red pulp. Then red pulp. Then reticular meshwork and the blood vessel. This is the components which are present in the spleen. The spleen is covered by connective tissue known as capsule. The capsule is deeply indented at the medial aspect of the organ, and this indentation is known as hilus or hilum of the spleen. The blood vessels, lymphatics and nerve pass through this hilus. From the inner surface of the capsule and from the hilus, many trabeculae radiate into the substance of the spleen and subdivide or delineate the organ into many communicating compartments or the lobule. Each lobule is supplied with blood vessels that run along with the trabeculae. White pulp. The white pulp is the accumulation of lymphatic tissue surrounding a major arterial vessel of the spleen. See the pink in color. This lymphatic system is composed of lymphocytes, plasma cell, macrophages, or other free cells lying in the meshwork of reticular fiber. The white pulp. In the white pulp, two distinct components they are seen. As the arteries leave the trabeculae and enter the splenic parenchyma, the vessels lose its adventitia and are replaced by reticular tissue, followed by invasion with the lymphocyte. This constitutes the periarterial lymphatic sheath of the white pulp. At various points along the course of the vessel, where the infiltration of lymphocyte is greater, it forms spherical ovoid nodules called the splenic nodules of the white pulp. The splenic nodules may have special germinal center rich in lymphocytes. Red pulp. It consists of two components. Sinuses. They are long vascular channels having 30 to 40 micron in diameter. They may have irregular coats and may vary in diameter. They extend throughout the red pulp. Then is the splenic cord. They appear as continuous partition in between the sinuses. Then is the marginal zone. It is the junction region in between the white pulp and the red pulp and consists of meshwork of branched reticular cells in association with extracellular reticulum, into which many arterial vessels they open. Now coming to the function of the spleen. Spleen is responsible for the formation of blood in the embryo. The spleen functions as hemopoietic organ of some importance, but in the normal adult life it never functions in the formation of RBC. Second, blood destruction. The old red cells and white cells are destroyed in the spleen. The spleen has got some influence on the formation of platelets. Hemoglobin breaks down and the formation of bilirubin also takes place in the spleen. Thus, in the postnatal life, spleen acts as filter which removes the old useless cells and allows only the young active cells to pass into the circulation. The next function is that it is a reservoir of the blood. Spleen acts as great reservoir of blood. It is observed that spleen may release about 150 ml of blood to the circulation in case of emergency. In carbon monoxide poisoning, this is a great help. Due to the presence of slow circulation in the spleen, carbon monoxide cannot saturate all the splenic red cells. When spleen contracts, these healthy red cells are turned out into the circulation and are used for carrying oxygen. Next is the relation to storage and metabolism. First is pigment metabolism. Hemoglobin is broken down to heme and globin. Heme portion is further split into iron and pigment hematodoinin, which becomes bilirubin of the plasma. Iron metabolism. The iron that is liberated from the hemoglobin is at first stored in the splenic pulp cells. Then it is gradually transferred to other places, being carried by the monocytes and the detached RE cells. These especially taken to the liver for storage and to the bone marrow for further hemoglobin synthesis. Then the function of spleen as defensive function. Many pyroneophil cells are found in the splenic red pulp, and hence the spleen is a chief site of immune body formation. The RE cells engulf bacteria and parasites. The pulp cells unite with certain toxin, especially of diphtheria, and removes them from the general circulation. The lymphoid cells of spleen also react against the infection. I hope the concept is clear. Thank you.